Welcome back, guys. So, we're going to be talking about management of diabetes or glucose or hyperglycemia. So, this basically is going to be talking about medications or where the medications at. So, think about what I told you in the first part or in the beginning of this video, that the pancreas might not be producing enough insulin, or it might be producing enough insulin, but the tissues are not able to take up the glucose with the insulin. Let's leave it that way, simple, right? So the medications, diabetic medications, there are some medications that will go to the pancreas and say to the pancreas, I need you to produce more insulin. There are medications that do that. And then there are medications that will go to the muscle tissues or to the adipose tissue. The adipose tissue is your body fat. Remember, your body fat is your healthy fat. They are the one that insulates you, stores energy for you, not the excess fat that we put on when we eat unhealthy fat. No, this is your body fat, okay? A percentage that you need to store energy. So some medications will speak to your adipose tissue, to your muscle tissue, and say, hey, we need you to go and pick up glucose and the insulin. It would say that, let's put it this way, the medication will go to the adipose tissue and to the muscle tissue and say, now the insulin has picked up the glucose in the blood. Now go and take the glucose. So medication does that. Then some other group of medication will also go to the intestine. Remember, if you watched my last video about, I think, gut and weight loss, your intestine, it's where digestion and absorption happens. So your intestine is also responsible in absorbing, in breaking down carbohydrate and absorbing the glucose, right? So some medications can go to the intestine and say, hey, Mr. Intestine, take it slowly in breaking down this carbohydrates because the body has excess already. So this class of medications will go and attach themselves to the intestine and say, intestine, slow down. So that's why it's very important, like when you're managing glucose, be very, very careful about portion control. Do not eat in large portions. When you eat in large portions, it causes a glucose spike. That can also interrupt with glucose control or a stable glucose. That's very, very unhealthy. So eat smaller portions, spread it out throughout the whole day, and try to eat like at the same time of the day. You can snack in between, but your meal, like your real heavy meal, should be a lower portion. Okay, when you eat large portions, your glucose level spikes. And if the pancreas is the one not producing enough insulin, your pancreas will say, hey, what are you doing to me? You're trying to overburden me. Why are you giving me so much work to do? I cannot make so much insulin for that food. So that's exactly what happens. And that's when you start feeling dizzy. That's when you have headache. That's when you feel so tired. Your mouth is dry. So try to control the amount of food you eat at a time, okay? And another organ is the kidney. The kidneys also are involved in blood glucose control. So remember, watch my video. Please, you guys should watch my video when I talked about kidney health, when I told you that the kidney is also involved in removing waste. Yeah, the kidney and reabsorption. So the kidney helps in reabsorbing glucose from the blood. When it's cleaning the toxic blood, let me put it that way, it removes the good stuffs and take them back into the body. And one of that is the glucose. The kidney reabsorbs. After cleaning out the blood, it takes the glucose that you need and puts it back into the bloodstream. Okay? So when it puts it back into the bloodstream, you have more glucose in the blood. So for those who have uncontrolled blood glucose, we have medications that will go to the kidney again and say, hey, Mr. Kidney, please, when you're done filtering the blood, we don't need you putting back the glucose in the system or in the blood. We need you to flush it out of the urine. So some medications actually do that. They'll speak to the kidney, please, Mr. Kidney, when you're done filtering, please pass out the glucose. We don't need it right now. Pass it out through the urine. So this group of individuals will pass out excess urine from the excess glucose from the urine. That's another class of medication. And another class of medication can also act on the liver. Remember, the liver helps to break down fats and protein to glucose. Okay, so some medications can go to Mr. Liver and say, hey, Mr. Liver, please stop breaking down fats, stop breaking down proteins to glucose. We have excess. Okay, so Mr. Liver is going to slow down in breaking down fats and proteins to glucose. So some medications do that. I know metformin is a very good medication. It does that. That's the first line medication we use for newly diagnosed diabetic patient. So metformin can act on the liver. It can act also on the muscle and the adipose tissue to control blood glucose. So metformin is very good with less side effect. And metformin also can help with weight loss. So that's why most people you see are on metformin. That's what we call glucophage. All right. So if you look at what I just said now, you see that the medication, diabetic medication, is not a one size fit all. You're going to work with your primary care provider to know which medication is best for you. It could be metformin that works on the liver, works on the tissues and the adipose tissue. It could be insulin. So insulin works on the pancreas also to say, Mr. Pancreas, produce more insulin. So you're going to work with your primary care provider to know which one is good for you. Okay, especially they're going to look at your A1C. They're going to look at the kidney function. There are some medications, like I told you in my previous video, that cannot be started if your kidney function, your GFR, is low. All right. I know metformin at very low GFR, we cannot give metformin. So you will be damaging your kidney. Do not share medications. Do not say my dad or my mom has diabetes. Now that I have it, I can share her medications. No, that medication might not be the right one for you. And your primary care provider needs to check your kidney function and also your liver or complete physical to know which medication is okay for you. Okay, and other lifestyle modifications that I keep emphasizing over and over in this channel is exercise, physical activity. Get moving. Don't just stand. Get moving. You don't have to go to the gym. Get moving. Take short steps. Take breaks. Walk, whatever it's in your tolerance level. Get moving. Weight loss. If you're overweight, work on weight loss. You can work with a dietitian or a nutritionist on weight loss. Okay, and medications also. Check with your primary care provider. There are some medications that can actually affect blood glucose control, like steroids. I know that some high blood pressure medications can make your blood glucose high also. So check all that. That's why you have to work with your primary care provider. And then diet, I cannot overemphasize that. High fiber diet, very important. So on a final note, if you already have diabetes, make sure you're getting a yearly check of your eyes, because uncontrolled blood glucose can affect the vessels of the eye. All right, and diabetes can lead to blindness. So if you know this now that I'm saying, always have your eyes checked every year. if your blood glucose is managed, controlled, there shouldn't be, the complication will be delayed for a long time. And also, uncontrolled diabetes can also affect the kidneys. Okay, so when the glucose is high in the blood, it damages the vessels, it damages the nerves. Okay, the kidney will lose sensitivity and lose its function. So controlling the glucose is very vital. And uncontrolled glucose also can, like I said, it can affect the nerves. I know a lot of people have, we see that a lot in the elderly, what we call a neuropathy. You see they complain about a burning sensation, pain, maybe in the fingers, in the hands, in the legs. And we have medications that can help manage that. So controlling the blood glucose is very important. Controlling the blood glucose is very important. We don't want it to get to a worse stage that it begins to damage organs in the body. So I hope this topic was very helpful. If you have questions, or if you have something you need me to clarify on, please, I need you to go to my Instagram page. There is a link, I think, on the page. I don't know where it is here, where you can link on my click on the Instagram page, and then you can DM me over there. Like I said, please keep your questions private, especially if you want it private. You can go to my Instagram and ask me questions, DM me, and I can always come here to discuss without even mentioning your name. I keep it private, okay? If it's something that I have to discuss with you over there on Instagram, I will do that, okay? And please keep liking my videos, comment, share with your friends. Please share with your friends. We're gonna do great on this channel, but I need your input, okay? I need to make sure that you guys are with me, that I'm not doing this alone, okay? And also subscribe if you haven't subscribed. And I know some of you have asked for live videos. For me, I think this is still very early. Maybe when I open up my Facebook page, I'm working on getting my Facebook page up. So hopefully in Facebook, we can do live videos over there, okay? So let's keep growing this page and growing our audience, and ask me questions. Do have a beautiful, beautiful, beautiful weekend. Bye-bye and stay safe.